Madam Clerk, we'll call this meeting to order. Please proceed with the council chamber amendments.
Upon activation of the emergency alarm signal, all persons should immediately exit the building. Please use the exits to the left or right front of the council chamber or the east or west stairwell outside the rear doors of the chamber. Do not use elevators or escalators. After exiting the building, proceed down 9th Street and into the assembly area located in the former Public Safety Building parking lot. Able persons should assist visually and hearing impaired visitors when exiting the building. Public speaker guidelines. Individuals wishing to speak during public hearings and the public comment period are generally allowed 3 minutes to speak. Persons appearing before the committee are not allowed to campaign for public office, promote private business ventures, use language of a personal nature which insults or demeans any person, including comments directed at public officials or staff members that are not related to their official duties, or address the question staff members directly. All questions are to be directed to the committee chair. Failure to adhere to these guidelines may result in speakers forfeiting any remaining time, and further disciplinary action is necessary, which can include barring from attendance at future meetings of the committee for a period of 6 months. And Madam Vice Chair, all members are in attendance today with the exception of Ms. Lynch, and you do have a quorum.
Thank you, Madam Clerk. Can we proceed with the public comment period?
Public comment is now open. Is there anyone present who wishes to address the committee regarding items not on today's agenda? Madam Vice Chair, seeing none and no one signed up to speak virtually before the 10 a.m. deadline, the public comment period is now closed and back to the committee.
Thank you. Can we proceed with the presentation from Social Services?
Good afternoon, Councilwoman Jones and Councilman Ms. Breton. Thank you. I'm Shonda Giles, Director of Social Services for the City of Richmond, and I am present, and some of my team members are here as well, and just want to acknowledge them as we get started. And please stop me. I know I have 10 minutes, but if you have questions, just stop. Let me know, and I'll make sure to answer them or get you the answers as quickly as possible. All right. So I'm just going to do a high-level overview of our department. I'm not going to read the slides to you. You have that information, so I might highlight portions of it. So please stop me if you have questions. Richmond Social Services is comprised of several parts. We have our children, families, and adults, which is what people typically know of as CPS, foster care, adult protective services, adoptions. And then we also have our public assistance programs, which are our benefits programs. So SNAP, Medicaid, TANF, energy assistance, child care. And then we also have some other supportive functions, but also some things I'm very proud of, and that's our community engagement team, our trauma-informed and resilience teams, who look at how we are addressing those things agency-wide, and particularly in how we serve. We are funding at state, federal, and local, some local funds. I will say that the vast majority of what we do is funded by VDSS at 84.5%. So the work that we do has a small fiscal investment by the city, but a huge impact in our city. So speaking of that, we are the second largest social services department in the Commonwealth of Virginia, second only to Fairfax. We currently have 373.8 full-time FTEs in this current budget. Thank you. But I do want to take a moment and just look at that number of the fiscal impact. I do not have fiscal year 25 data that will come out from the state in October. So this is fiscal year 24, the economic impact of those who have received services through us. So you're looking at client spending in addition to our spending, but primarily the vast majority, if you think about Medicaid, food, child care services, we're at $992 billion in our economic impact with a 16.5% contribution of local dollars. So if you're looking at the economic impact of those that we serve in the city, which is roughly 45% of the city's population, they have a huge economic impact. And I don't think sometimes folks stop to think about health insurance coverage and what they're spending for food, for SNAP or TANF. That's a huge economic impact. So I just want to take a moment and look at that number. I know it was a little bit surprising to me when I started. And when I started 10 years ago, it was probably about 500 million. So we're almost at $1 billion now, 992 million. I think I said billion, $992 million. And as I said, we do serve roughly 45% of the city's population. We have gone down. It was as high during COVID. I believe at one point in time, 133,000 went down. Last year, I believe audited data was about 113,000, which was 48% of the population. And we're now down to about 45%. I would say that's probably because of the Medicaid unwinding, that some folks rolled off of Medicaid that were no longer eligible for it. The unaudited data, again, it comes out from the state. It's a point in time, and they look at September 30th so that we can measure over time. And so looking at our September data as of last week, we have 225 youth in foster care, just about our normal rates. For our Adult Protective Services hotline folks, they received 1,200, almost 1,300 complaints to the hotline. And again, unaudited data from DARS, not VDSS. Is that who oversees that? Let's jump into the benefits programs. And just some definitions, because timelines change, or how the timeframes that we're looking at change. VDSS state budget cycle is June 1st to May 31st. So we try to align our reporting so that you can really see the fiscal impact for that year with our state budget cycle. But there are some other places where you will see fiscal year or calendar year, just because, again, we have unaudited data at this point. Richmond is a level 3 agency. So you can see, if you look up there, sort of what level 3 means, and they're the largest agencies. And in the central region, that would include Chesterfield, Colonial Heights, Henrico, Petersburg, and the city of Richmond, with Richmond being the largest. And just color-coded charts help me picture it. Richmond is in the central region. And of that central region, we are a level 3. And so the request was around looking at the timeliness of processing our applications. So meaning we receive them and there's a certain time frame in which we have to process them. So for our Medicaid applications, that is 45 days. And the benchmark really is they want you to process 97% of the applications within 45 days of receipt. So I just want to clarify, when you're looking at that data, it could be an application from June that came in June 1st, but needs to be processed by July 1st. And our data, we've also put on the state call center, who also processes Medicaid, to sort of see how our metrics line up with them. We are on an upward trend. I think when you look through some of the graphs, particularly January, February, March, you're going to see the downward slump, but also recognizing that time frame, we had a water crisis where our staff is responsible for mass care and emergency sheltering. So we had some things set up that they participated in EOC, but also closures, holidays. So you'll see a dip during that time frame, and then as we're going back up. And then in that time frame, because we process generally, with the exception of childcare, meaning that one worker processes, because I would say 98% of those who submit applications aren't just applying for Medicaid. They're applying for Medicaid, SNAP, and TANF. And so what you will see, you should see a similar trend in where the dips are, because they're processing the entire application, because you need basically the same information to assess those programs and determine eligibility. And I'm talking fast, so let me know if I need to slow down. And so I wanted to provide the comparison of the timeliness of processing with other localities. Looking at Richmond, we're actually ahead for level 3s around the Commonwealth, and ahead for central region level 3s and our timeliness of processing. And then TANF, you see the dip in TANF. I will say we want to measure it looking at pre-COVID numbers versus current numbers. And TANF applications we have 1,000 less TANF applications. So when you see that dip with 1,000 less applications that you're comparing, it's by way of example, if we had 10 applications and 5 were late, then that's going to be a 50% processing rate, if that makes sense. But some things to consider when you're looking at timeliness: staffing, days that we're out, latency with the system, so when the state system is down. Some other things to consider around it is we don't have all the documentation that we need when we're processing, so that speaks to or plays a role in what that looks like. And then the SNAP, again, the SNAP waiver ended, interview waiver ended during that time frame, so we had to begin interviewing clients again around SNAP. And that TANF is a 30-day processing time frame. And again, here is, we are in relation to it. I will tell you that looking at our efficiencies, we did so well. Let me go back. You can see our numbers go up. In April and May, we just sort of looked at organizational efficiencies and shifted how those applications come in and who they go to. So we are monitoring the data and figuring out how we can be more efficient. We're a living organization and constantly growing and looking at how things should shift. And I can say during Medicaid unwinding, we had probably about 26,000 applications that we had to get through that backlog in about, I think the state gave us 18 months. So we shifted what our staffing looks like. And if you'll recall, we had about 46 permanent part-time folks who worked from other localities after hours on our teams. And now we're able to shift some of that staffing back to full-time as we rotate off and look at what our needs are. And then SNAP. We're looking at non-expedited SNAP. So those applications that have to be processed in 30 days of receipt. You will see the same dip in January, February, with it going back up. And you can see where Richmond falls in relation to other localities around the timeliness of our processing. So we're on par really with the level 3s in the Central region. And then this is childcare, where we've always excelled in, but it is our smallest team, smallest amount of applications that we receive. And so, well, it's the smallest program, not the smallest team, but we're adequately staffed for the volume that we receive for our childcare applications. And this is where Richmond falls in comparison to the state and other localities that are of similar level. And I did want to note, during COVID, we had some waivers and additional funding from the state. We localities determine eligibility, but the actual funding from child care comes from the state. It's not local funding that pays for those slots. So I was very proud of, for a while, we had everybody who was applying for child care spots received it. We now have a wait list of 786 as of May of 2025. And federal updates. So beginning in October of 2027, states with a SNAP payment accuracy rate above 6% will be required to contribute a state match for SNAP benefits for eligible low income. So it's that administrative component that the state pays for right now at 50%. If you're above 6%, then you have to pay 25%. So the states will be taking on a much larger amount of funding for that. And so what they're specifically looking at, let me make sure I get this right, is the positive error rate. So that overpayment error rate. And Richmond's is currently 14.1%. And in that central region, it ranges from about little over 7% to 39%. So we are working, and I just have listed some things that we put in place in partnership with the state to get that error rate down by October of 2027. So we are grateful that we have some time to get that error rate down. And hopefully, my expectation is as a state, we will, so that there will not be any roll down impact on the localities around any additional funding that the state would have to find to pay. So that additional 25%. So all of our staff now are enrolled in SNAP refresher training, because it really looks at accuracy. It's not just do you determine it in a sufficient amount of time, but what you've determined, is it accurate? And so And that really is around training and QC. So if you can see up there, we have developed a quality assurance and quality control team internally. So not just looking at the state coming in, but us coming in. Now we need to staff that team, but it's the proactive things that we've taken to start looking at this on the front end. And the state does case reviews, and we have internally done some more case reviews so that there are more eyes on this. And then Medicaid changes. So beginning in January of 2027, there is the Commonwealth must implement a community engagement requirement for certain Medicaid enrollees. So those are those able-bodied adults 19 to 64 who will no longer qualify for certain exemptions around work. And so we are working with our state partners and developing that community engagement and maybe reaching out to you all at some point to disseminate some information to your constituents around it. The other thing that the big beautiful bill requires is localities must now determine eligibility redetermination every 6 months instead of annually for expansion populations. We're still trying to determine what that would look like, both volume and staffing, and those are the conversations that I'm having with the DCAO and CAO really around optimizing staff, but we're still figuring out what that would look like. In expansion states like Virginia, allowable provider taxes which fund Medicaid program will be reduced each year. So between 2028 and 2034 from 6% to 3.5%. So it could impact the federal funding of those programs. So you would see that on what services are provided by medical healthcare providers to recipients, if that makes sense. And then the last one is HR 1 also removes refugees from the definition of qualified immigrants, which eliminates their access to federal health benefits. So no Medicaid. Now, any questions before I leave benefits and head over to the other side of the house? So our children, family, and adults programs, we call CF&A because that's a lot of words. I'm just going to go through and highlight some of those, but one of the things that I do want to highlight is our adult services partnered with the Office on Aging and Disability Services and launched a monthly seminar to educate our older adults and their loved ones, and our congressperson came in to speak, so we were very excited about that. Our Child Protective Services, and what we pulled, the federal government measures states around, it's called the Children's Services Family Review. So they're really looking at certain benchmarks or certain metrics, and they're looking at outcomes. So having experienced your system, is a child or a family better off at the end of that experience versus the beginning? So it's a very intense process. Interviewing Richmond has been selected every year that I've been here that they do it, and it starts again in October, but we are intentional about tracking those benchmarks that they look at, and so I wanted to highlight those for you all. So the timeliness of first contact with the victim of a valid CPS complaint, the target is greater than or equal to 95% based on the response time. So if it's severe allegations, 24 hours, less severe cases, but urgent response, 48 hours, and then lower risk cases, 5 days. So 40 working hours. They're looking at the working hours that staff have, and they're not including weekends or holidays, although we do work during those time frames. But I do want to say that the timeliness of first contact it looks at actual interview observation. It does not account for the attempts made to reach the child. So if you think about when it's easier when they're in school, but if they're out of school, it might be a little more difficult to track the family down, or you don't have you might have the address, but not the right apartment number and things like that. So it does not account for those things. Or the time that you go, the child is not there and with someone else. It's that actual face-to-face that we look at. And then for foster care, the CSFR, looks at monthly foster care visits required should be equal to or greater than 95%. And then monthly foster care visits in the residence. The target is greater than 50%. And so you're making sure that you see them each month, but you also see them in the foster home each month. So seeing them could be taking them to a doctor's appointment, court date, visit with a parent, but wherever they're residing at that point in time in foster care, whether it's a congregate placement or with a foster parent, you also have to see them that way in that residence as well. And that's at least 50% target rate monthly. And our Adult Protective Services team, similar in some ways to CPS, but very different in other ways because you're dealing with adults who have autonomy. So we don't go in and do removals of adults. We would have to go through the court system, get guardians in place or a conservator in place if it's some type of financial exploitation. And so we've received a little over, well, approximately 1,300 complaints to that hotline. They've investigated 817 of those to be valid, and they do keep those cases to resolution. And whether it's working with family members to get them into a safer environment, but resolving whatever that issue was, the underlying issue. And sometimes it's referral to the police or to law enforcement so that they can address whatever the exploitation or abuse was. 6.27 of all complaints that were received have been investigated and validated. 62.7, sorry. And separate from our APS, which involvement is involuntary, our adult services is voluntary services. So it may be that a complaint comes through, it's not valid, or it might be valid but not high level, and they just need some additional services, and it'll get referred to our adult services. So they can put a companion services in place, but refer them to services within the community that can assist them. They do the assessments. So I have the Medicaid screenings for assisted living placement. So they do those screenings in partnership with healthcare providers. It could be transportation to appointments and other supports to help them live independently. And it is voluntary. So we're taking referrals. And then they do carry a caseload, so care management around it. So they have 282 guardianship cases that they manage. So when you are appointed as a guardian in the city of Richmond, whether we've had that case or not, you have to submit your annual report to Richmond City. And they have 40 ongoing companion cases currently. And then our Healthy Families program. One of the reasons I love this program so much is because it's true foster care prevention. Less than 1% of the families that go through this program we see in CPS. So I'm touting this program. I'm going to email the clerk some brochures for you all to refer folks to the program. It is an incredible program. We're currently serving 92 families. We had 92 families referred. 37 families we're currently serving. And while we serve the child that meets the eligibility, the target child, we serve all the families, so all the kids that are in that household. So while we have 37 families served, it's 166 youth served, including those who are not the target population. So we're not going to come in and do a referral for one and see something else going here, maybe around mentorship that they need, and not do a referral for that. So they've done, it's a home visitation program, so similar, it is like Family Lifeline and some of the other home visitation programs in the community. Richmond has its own home visitation program, and we've had it since the mid-90s. And so we've done 871 home visits. Our funding is through Healthy Families America. And so what we are asking is for more referrals. So that's why I'm going to send you more things. They look at how many referrals we receive as a locality and base how they fund us on that. Not participants, but referrals. So the more referrals we receive, it will enable us to expand that program more. And again, I can't tout it enough. It is our true evidence-based foster care prevention program. And we're in those homes from, 0 to 3. So. And then our solutions support team. So that's our call center that supports 311. So the calls that come through 311, I'm recognizing that there's a lot of federal, state, and local confidentiality requirements around those we serve that client information can't go to 311. So we have our own team that receives those calls. And we have different ways of how they're escalated. You will notice, and I'll go back to how we've improved our closure time, but let me explain what closure time it is. It's not just I'm calling somebody back. It is I've received a complaint, call whatever the issue is. So if it's I need to submit my documents, or I need to check on the status of where my case is, or I need to do a change of address. And a change of address is an eligibility determination, so they can't do that over the phone. So for staffing optimization, we hired some retirees from Richmond City, or other localities as well, actually, to work that call center so that they could do the change of address as a benefits processor. Because it is considered eligibility, but it would go into the rotation for our staff. So we realized that's something that we can do fairly quickly if we had somebody who could answer that phone. So we're constantly looking at things like that, but resolution also means it's not just, has my case, what's the status? It's the workers call the client back, and then 311 staff have called to make sure that the issue is actually resolved, not just that they've received a phone call, which is why we have the 21 days, because it could be they're calling about their case and there's still, they submitted the application on a Monday and want to know why it's not processed by Friday. And so we will make sure that we're looking at when it's processed to close it out, if that makes sense. And the big move that I'm so excited about, and we're at the light at the end of the tunnel, and it's a little bit blinding for me, but I'm very excited about our move. And I just wanted to let you see a little bit. And let me be clear, Marshall Plaza is moving. Southside Plaza, our customer care center, will remain there, so the public won't notice a difference in coming in, other than there may be a few different faces because we're going to rotate folks through that location. So, video for you. So I want to do a shout out to Ashley Stein and the DSS IT team. She is both the videographer, producer, script writer, casting director, all the things she has done. And so that's an old video. I think they're installing furniture now, but I was not going to show you all that video before we showed staff. But I will invite you all to come and take a tour because it really is amazing space. It honors those that we serve, and it honors the staff. And I will say that year a lease is, at a minimum 15 years, I think, with a 5-year renewal, so 20 years. I will not be there in 20 years. And so we were intentional about who designed that space. And so we have direct line workers. If you served in any leadership capacity, whether it's formal or informal in our organization, whether it's our impact morale building team or our trauma informed care team, they were all invited to say, hey, you have an opportunity to lead this. We use this social change model of leadership where leadership is not a position, it's a process. And so we said, this is what we want. We want community engagement. What does that look like? What does hospitality, so we have a hospitality work group. What does it look like in how people experience our space? What does it look like in engaging our neighbors and moving to a new space? How do we want people to experience social services and going through? I was like this is a once in a lifetime opportunity. So we really got to lean into it. What does it look like being trauma informed in that space? From the colors that were selected to the setup, we have amazing visitation rooms, for our families, but also space for kids to hang out if they're being removed. It does not look clinical. I think I walked down the hallway and how they set up the lighting looks like a gallery, so I started to cry. It is incredible space, and it really does honor those that we serve. And just here's some details on the East Franklin Street project. We're looking at October, November for move-in, so you'll start seeing some printed material come out to you all. I haven't put a date on it yet because sometimes people don't see dates. They see October and then they'll show up at the new space. We won't be there. And we even have a logistics team that's really looking at how do we move with the least amount of impact to those that we serve. And again, we will continue to be at Southside Plaza, where I will say, again, I go back to this new space is amazing space, and the rent from that space is reimbursed at 84.5% by the Commonwealth of Virginia. So thank you, VDSS. And they have been involved with us from the beginning, making sure that we met all the requirements in advance, like as we're doing the lease and negotiating the lease. Which shifts us to Southside Plaza. I put up there in big bold letters, DSS customer service will remain at Southside Plaza so citizens are able to continue to receive the assistance that they have at that location. We're in the middle of lease renewal there. We're currently on month to month. So you may see some legislation coming through soon as they finalize the negotiation of that lease. And I'm excited, and I will not steal the thunder of DCAO Popovich on the additional services that could be available because we are exiting. So we're going to be able to serve the community in a different way, and I'm very excited about that. And if you haven't done a walkthrough, the carpet was replaced on August 24th on that first floor, and it made a huge difference. And there, again, I will not steal DCAO Popovich's thunder, so I'm going to stop talking about that. Questions?
I was like, first of all, I got to take a mindfulness breath. Ooh, that's a lot.
It is a lot.
Thank you so much, Dr.
Let me
Giles.
just say, I've edited probably about 20 of those slides. So for the teams that gave me information, I apologize, but
I was like,
they
if she
do a lot.
click and one more team pop up on here, I'm just not gonna know what to do with myself. But seriously, thank you so much for this presentation. And you saved the best for last, the move in, but it definitely, I love when you hear something that you literally and personally can feel the change happening. And I feel like everything that you just presented is showing social services on the rise and on the move. And it is what our city needs. It is what our residents need. It's what our families need. And so thank you to whoever, to all, who have been a part of this process and helping it move. Immediately, all the things that you were talking about, I could not resist putting on my former school board hat because I'm like, I see alignment with this and RPS in such a way that is going to change the trajectory of our families. And so I really think that as you are continuing to build it out, I'm not sure how much conversation you are in with RPS, but it would behoove this new process for us to work together and really be thinking about. The only thing I was going to ask you about, you mentioned the trauma-informed team. What does that look like, and how is that, positioned from an external perspective?
So we have a LCSW who leads that team, is Kelly Brown, who I'm not going to call up because she wasn't expecting that.
Yeah.
But there are a variety of ways that we serve in that, from even our current facilities and having that team come together to go, we're experiencing vicarious trauma, sometimes direct trauma as well, because if there's a child in a home and there's a fatality or a shooting, our staff's called in, secondary to the police. And I don't think folks really think about that with the trauma that they experience. And so we have resilience rooms. So what does that look like to just take a moment and go into a space to calm down, reset? They do meetups or chats virtually. So there's constant things that they're doing monthly, if not weekly, to make sure that we're touching base, being very mindful. They've partnered with Cigna and some other nonprofits around grief counseling and things like that, or even providing advice on how to navigate cases where kids have trauma. We have developed a partnership with RBHA for our displaced youth when they are. So those are kids who, two that I can think of offhand who are teenagers who've had upwards of 50, 60 placement denials. And so they're either in a hotel or at Marshall Plaza. Our new facilities have showers. We'll have laundry facilities, Very excited about that because you don't think about those things when you're trying to figure out where is this kid who's living in a young person who's living in our building going to get a shower today. We have about 10 churches that support us who will provide meals or gift cards and things for make sure that they're eating and their needs are met. Like the support that we receive from our community, faith-based in particular, has been incredible. But back to trauma-informed care. So we are very intentional about how we approach that at every level. What does it look like in our policies? What does it look like in support of staff and the work that they do? It was amazing to have that team in place during COVID because I'm a supervisor, has your director who's getting on the call with supervisors, some who've lost multiple family members. And at that point, our services were critical. And so I'm getting some feedback on I can't get on that call while we're all experiencing this global pandemic and not acknowledge the trauma that folks are going through in a different way. So helping me as a leader navigate what that looks like, helping staff navigate what that looks like, what to look like, what does burnout look like and what things can we put in place. The other thing that I'm very proud of that has not been finalized yet, we're still sort of going through legal and some risk management around insurance. But part of the things that we're looking at for purposes of retention is having those who are LCSW candidates who have to get their clinical hours, they can actually use their work for DSS to get those clinical hours. And we have them going outside of our agency to get those clinical hours. And sometimes they recruit them outside of our agency. So we are developing a LCSW supervision program where you can get those clinical hours within Richmond DSS. And it's about 2 years to get them. So we're retaining them at least for another 2 years doing that program.
And that team is citywide, right?
This is local for DSS.
But what I'm saying is they serve the city residents, or is it only internal?
It's only internal.
Only internal for DSS. Okay. All right.
So we partner with the trauma-informed care team, the Greater Richmond Trauma-Informed Care Team. So you may see them serving in different capacities in nonprofits. I know they've done some training, as has Kelly, in partnership with them, with school resource officers around trauma-informed care, because we all serve the same families. So there is a broader group that we work in connection with, and that's regional, not just local.
Okay. And then my last question, you mentioned about the Healthy Families Program, and you were saying, the more referrals you get, and again, it comes back thinking about RPS. Like, are you working with like CFIT and all of them for that program? Because I know that is probably one place that you could get a lot of referrals. And then if you, and then kind of moving it on to the next. So want to just ask that.
We're closely partnered with RPS, particularly their preschool programs and things like that. We receive a lot of referrals from hospitals and medical centers, so we partner with them as well. Mm-hmm. But we are closely partnered with RPS, and we also disseminate their information to make sure that the young folks there, the babies that we're working with, are on that trajectory for preschool and all the things that we could reconnect them with RPS, sort of a warm handoff is, I guess, a good way to say that.
Yeah, I could ask you questions all day, but I'm not. I would love a tour, and I would love once you all get up and running to really come over and visit. I'm already like my brain is like, oh, okay, and I'm trying to make all the connections. So we won't do that here today, but I'm really excited about your presentation and what's to come, and your passion for really uplifting social services in more of a human-centered way. And I think that this is going to be amazing, and I'm super excited. Do you have any questions, Mr. Bratton?
I want to understand more about that comparison between 900 million and 16 million. I mean, it's such a big ratio of like investment being made in these families and our slice. What does that 900 mean? Is that money that flows through the programs that we administer, or just money that also touches these people in some other way? Like, what is that comparison?
So it's the money that flows through the program. So if you think about someone who's receiving Medicaid, they're literally looking at each dollar that is spent on their health care. So the healthcare providers in the city that are receiving it, they're looking at their TANF dollars that are spent. Once we determine eligibility, they're tracking every dollar that our clients, those that we serve, are spending, whether it's in the city, outside of the city. They're also tracking all the funding that we're spending for foster care use, whether that's mentorship service, whether it's residential placements or things like that. That every dollar spent for clients or the clients are spending is the vast majority of that, honestly, is Medicaid, it's healthcare coverage. And I actually have a little chart that I can actually send to you all so you can see the breakdown of it and you can see the local cost. So if you're looking at local cost, staffing is in there in that 16 million. Our administrative cost is in there, but what you receive for it is incredible.
Yeah, it seems like 2% is like, right, 1.6 out of 1,000. It's such a large ratio of the dollar benefit that we're managing, that they're getting, and the amount that we're giving. Okay, I always want to make sure I understood
Yes.
that was what that really meant. I want to ask also, so I guess maybe similarly, we're getting a large maybe subsidy or break on the rent. Is that of that new building? So then it sounds like we're getting like 84%. So then what is our share of the rent there?
So our rent, the first full year that we will be there will be 3.2 million. So 84.5% of that is reimbursable by VDSS.
Got it. So that 3 million is the total, but we're only paying a little fraction of that. And is that going to be ongoing? Like it's always every year we expect that type of ratio?
Yes. So there was some intentionality when we were looking at relocation, because the city, we previously were renting Marshall Plaza. The city owned it. Once the city had ownership of it, we only were able to get reimbursed for depreciation, I believe every 2 years. And so we were intentional about looking at what new spaces would look like and whether it be city-owned spaces or whether it be a rental.
And then I heard that we're also managing our error rates for, was it SNAP, where the state is maybe, it sounds like we're sort of getting like, there's like this penalty for errors to try to encourage better error rates, as what it seems like, right? So what sort of level of exposure do we have? Like how much might we be on the hook for this penalty, that we're trying to reduce?
That I don't know yet because I don't know what it would pass down. Right now, that 50%, so there's an administrative cost for SNAP that the state funds, 50% of the administrative cost of SNAP. That's not passed down to us. The feds are now saying if your accuracy, your positive error rate around SNAP payment accuracy, i.e. you're overpaying constituents or recipients, then above 6%, if that error rate's above 6%, and I will say that initial legislation had it at like 0. So above 6%, and that could just be a typo when you're entering in all those numbers. But anything above 6%, then you're going to have to pay, the state is going to have to pay 25%. I don't know what that would look like if we reached it. Our goal is not, but to go back below the 6%, which is, I'm grateful that it's not effective until October of 27. But there could be some level of pass down. What I would expect that to be is not that we would pay money, but our reimbursement rate might shift, meaning that we would no longer get 84.5% reimbursed, if that makes sense.
I see. Okay, and then I think my last question is related to SNAP. Reminded me of there were a lot of thefts of SNAP benefits going on, and I wonder, is that still going on, and is there anything that the city has been able to do to help families impacted by that?
So the theft is happening at a level where we determine eligibility. We don't give them money. So what the state has done is they've implemented at least where they can turn their card off, sort of like you have on your debit card. They didn't have that functionality before, that once you use it, you can turn it off so that no one can actually use it and then you can turn it back on. So that is happening. The theft is still happening. And I will say prior to the larger volume of EBT theft, we've always had some level of EBT theft. It just didn't look like it coming off of the vendor on the front end. And I do believe at the federal level, someone was arrested around that SNAP EBT theft. Okay. But we are still submitting the attestation forms to the state, and I don't have the number, but it's not nearly the volume that we saw before. So even if you're looking at our call ticket volume and all those things in November, December, January, so 24 to 25, that was during that peak season of the SNAP EBT. So we were also replacing cards. We can do SNAP EBT replacement, but we couldn't give them the money on the card. That ended in December, and that was federal funding that they were replacing it. I want to say in 1 month, this Commonwealth in November, I think, did $9 million in replacement EBT theft.
Yeah, thank you. Thank you.
Thank you so much, Dr. Giles.
And I'm happy to have any conversation or answer your questions offline whenever you're ready.
You know I got them coming. Madam Clerk, we'll go with discussion. Up next is Richmond Public Schools.
Good afternoon, Councilmember Jones, Councilmember Breton. I am delighted to share just some very brief updates about RPS and then, of course, answer any questions you may have. As I shared at our joint meeting with City Council a couple of weeks ago, our SOL results have been released, and glad to report that we are up again for the second year in a row in reading, math, science, and history. I will also note that if you look a little bit deeper into the data, you see some very exciting trends. For example, if you look at economically disadvantaged students, which are the overwhelming majority in RPS, in reading, for example, and you compare our performance to that of the state, you see a pretty stark difference. While we are still overall below the state, over the last 2 years, the state has grown 2 percentage points, while RPS has grown 10 percentage points. So growing 5 times as fast with this very key demographic. Additionally, we are now at the state average for reading in terms of our multilingual learners. We and the state have a long way to go, but that is the first metric that we are actually now at the state average, and hopefully we will soon exceed the state average. I'll also note our graduation data will be released by the state soon, and there will be more good news to share at that point. But of course, I can't share anything until it is formally released. Those are the big updates. Happy to take any questions.
He always has questions, just FYI, but
Fair enough.
I just want to say, I was very excited about the increase in multilingual learners. That is awesome. And I also am excited that Reed is getting a dual language program. That is
Yes.
amazing. I'm super excited about that. And just overall, the increase with the multilingual learners and the emphasis on it now to continue to grow and assist, that population. So thank you.
Yes. I have to give a big shout out to Dr. Jennifer Blackwell, who
Yes.
leads that work. Under her leadership, the team hired 55 ESL teachers this year. Grateful for the state funding for that, but it's not easy to find those folks, and she did.
Awesome. Thank you.
Well, I was going to share that, I really enjoyed, I attended the joint meeting you had with our state delegation last week. I thought it was a really useful conversation between school board, state delegation. You guys were able to kind of get through some conversations to get constructive information to each other to help them advocate for us and for you. And I thought that was really great that they were there. And my poor kids had to sit through it too, but my daughter even learned something about SOLs while she was there. And I wanted to ask about our students' job readiness and the future of the Southside Technical Center. And I guess in the context of that is that I know that we have the Future of Workforce Commission has been doing a lot of work around proposals for what we can do to improve our student job readiness. And so I'm wondering if you have any updates or plans around like the Southside Technical Center and other things about getting our kids ready for job readiness.
Thank you, Council Member. First, let me just reiterate our gratitude to the Richmond General Assembly delegation and all of the excellent work they have done and continue to do on behalf of RPS, on behalf of K-12 education. As for the Technical Center on the south side on Maury Street, the next big milestone is the receipt of the feasibility plan that we have contracted for. That will be available probably in the October timeline. That's going to lay out in much greater detail what it's going to cost, what some of the construction needs are going to be, what a realistic timeline would be, and so on and so forth. So that's the next big milestone. Of course, when that's ready, we'll come to the board and share that, and then I'm happy to bring it to the committee as well and walk you all through it. But there are some very exciting sort of initial concept plans that they're exploring, and really looking forward to that next step.
Yeah, I would just encourage you all to also check in with the Future of Workforce Commission as well while you're doing those plans.
Yes.
Thank you.
Thank you so much. We don't have anything else.
Thank you. Have a wonderful afternoon.
Madam Clerk, move on to Miss Amy Popovich.
Good afternoon, Councilwoman Jones, Councilman Breton. Just a couple of announcements. We've got 3 new staff that you all may have interacted with, but wanted to make sure to formally introduce them. They're just going to stand and wave as I introduce them. First is Allison Sailors. She's our new Director of the Office of Homeless Services. Here's Allison. Anna Jones, you'll hear from in a minute. She is our manager of the Office of Substance Use Response. And then we also have Anissa Smith, who's our new Equity and LGBTQ advisor. So very excited to have them on board. They joined this summer. They're orienting very quickly. We're connecting with you on some of them already, but happy to continue to reach out and meet about the important work they're doing. 2 other just exciting things that are happening this week that wanted to make sure was on your radar. On Tuesday, we celebrated Mayo Island. You all may know that in January 2024, the city acquired Mayo Island, and we secured a permanent protection through a conservation easement that was finalized last month. We leveraged $9 million in state funding, and this was a partnership through the Commonwealth of Virginia, the city, and the Capital Region Land Conservancy. So we're really excited. In about a year or so, we'll have a new natural park that our residents here in Richmond can enjoy. And then the second, tomorrow, would love to invite you to come out to the ribbon cutting of Lux Field, our community center in the east end of Richmond. It's at 1 p.m. This is our 3rd of 4th centers funded either new construction or renovation through ARPA dollars. We opened TB Smith last month. This too will have an indoor gym and a walking track, as well as the 3rd floor basketball place, gym, sorry, brain freeze, that you'll get to have windows at, and you get to see the city while you're playing basketball. Also has a community garden, super cool thing. So shout out to the Parks and Rec team for all of their work there, and really, really proud of our new space. You'll see a theme that we're trying to bring into human services, which is quality spaces where our people are. So we'll continue to push into that in the years to come. Any questions?
We don't have any at this time. Thank you so much.
Great.
Thanks for the updates. All right, Madam Clerk, you want to move forward with the papers? Start with number 1.
Okay. The first paper for consideration is item 1, Resolution 2025 R036, to approve the city's participation in the proposed settlement of opioid-related claims against Alvogen, Amneal, Apotex, Hikma, Invididor, Mylan, Sun Pharmaceuticals, Zydus, and Zandos, and to execute the documents necessary to effectuate the city's participation in the settlements, including the required release of claims against the settled entities. That paper is before the committee.
And I apologize, Madam Clerk, and I'm looking at Candace. I should have did the 2 together as a block. Is it okay if she can do that? Okay, thank you. So can you just add number 2 with that as well?
Noted, Madam Vice Chair, yes. Item 2, Resolution 2025 R037, to approve the city's participation in the proposed settlement of opioid-related claims against Purdue Pharma and the Sackler parties, and to execute the documents necessary to effectuate the city's participation in the settlements, including the required release of claims against the settled entities. Those papers are before the committee.
Do we have someone for the administration to speak to these papers? Thank you.
Good afternoon, Vice Chair Jones and Councilmember Brenton. I'm Anna Jones. I'm the opioid response strategist with our Office of Opioid and Substance Use Response. These resolutions authorize the city to participate in the 2 newest opioid settlements. This is a required step for the city to be able to participate and receive funds. To give a little context, this is the same process that the city has gone through before to receive previous settlements. We're in pretty close contact with our partners at the Virginia Opioid Abatement Authority. They estimate these two settlements to be about 1.6 million over 15 years distributed to the city. And again, these resolutions don't authorize any expense of these funds, and we would be back before council to propose any use of these funds moving forward. Very grateful to Caitlin Weston and our city attorney's office for their support in this process, and I am happy to speak to any questions.
You don't have any questions at this time, Madam Chair. Could you? I just looked at him and he's like, no.
I know, I saw that.
Public comment on public hearing on this one.
So is there anyone in the chamber who wishes to speak in opposition to these papers? Is there anyone in the chamber who wishes to speak in support of these papers? Madam Vice Chair, seeing none and no one signed up to speak virtually regarding either of these items, the public hearing is now closed and back to the committee.
Yes, I make a motion that we forward these papers with a recommendation to approve to council.
Second.
The committee is voting on the motion to forward items 1 and 2, resolutions 2025 R036 and resolution 2025 R037 to council with the recommendation to approve. Mr. Breton?
Aye.
Vice Chair Jones?
Aye.
That motion has been approved.
Go with number 3.
The next item is to approve the Richmond Behavioral Health Authority's performance contract for fiscal year 2026 and 2027. That paper is before the committee.
Do we have anyone from the administration to speak to this? Thank you.
Hi, good afternoon, Vice Chair Jones and Councilmember Britton. I am Christy Zed, the CEO of Richmond Behavioral Health Authority, and I am here to speak with you this afternoon about our annual performance contract, which is our contract between our BHA and the Department of Behavioral Health and Developmental Services. This contract establishes the funding and service expectations for mental health, substance use, and developmental disability services within the community. And while RBHA manages the contract, the city of Richmond is required to sign as the fiscal agent, ensuring local oversight and accountability. As you know, RBHA is the statutorily designed public body and the city of Richmond's safety net for mental health, substance use, and developmental disability services. We are the public authority, governed locally, and accountable to the city and charged with serving the most vulnerable individuals in our community. We serve more than 13,000 residents annually across every council district. The people we serve are your constituents, individuals and families navigating complex needs related to trauma, housing instability, addiction, crisis, and disability. We also play a role in the public health infrastructure that align with your priorities, preventing unnecessary hospitalizations and incarcerations, connecting people to housing, employment, and recovery, and providing critical care to individuals in crisis 24/7, 365 days a year. I want to thank you for your continued support of RBHA and our mission, which is aligned with your priorities. Your partnership is essential as we work to strengthen Richmond's behavioral health system and create pathways to stability and recovery for our residents. I'm happy to answer any questions that you may have at this time.
Thank you. We'll hold a public hearing first, and then if we have any questions, we'll ask you to come back. Thank you,
Thank you.
Madam Clerk.
Is there anyone in the chamber who wishes to speak in opposition to this paper? Is there anyone who wishes to speak in support of this paper? Madam Vice Chair, seeing none and no one signed up to speak virtually regarding this item, the public hearing is now closed and back to the committee.
Okay.
Yep.
Would you mind coming back to the podium? He has some questions.
I think one thing I'd like to understand is I believe that we usually do a 1-year contract, but is this the first time we're making a 2-year contract? Is that a change from the past?
It's not a change. It's usually a 2-year, but we are required to do it annually. So it's for 2 years out. So it includes the current year and then the next year, but we have to present it locally annually.
So does that mean that like a year from now, we will be talking about this again?
Yes, you'll be talking about it every year.
Okay, but this is not a change from the past. It's always been a 2-year cycle. Okay, and I see that $6 million. That's $6 million for this year, but then there would be another $6 million for the following year, or if
Yeah,
roughly that amount.
Right, roughly. So it's based on 10% of our state general funds and and that's how the local match is comprised. So that varies from year to year depending on the state general funds that we receive.
Okay, so it sounds like we're about approximately 10% of your funds come from ours, so we get a 9-to-1, bonus on that.
Yes.
Now the people that you serve, are they Richmond residents? Like, what fraction do you have a sense of what fraction of your people that you serve are Richmond residents?
We serve all Richmond residents. We are the safety net provider for behavioral health services, as I indicated. We do provide some services that are regional for the 7 regional areas that are Henrico, Chesterfield, Hanover, District 19, and Crossroads. Richmond, of course, is in there. So those are mostly crisis services that we provide as the crisis hub for the region. But all of our other services are locally to the citizens of Richmond.
Okay, and I guess, can you help me understand, I guess, what the relationship we have between each other, like with how someone within the Richmond city is, like the oversight that we have of your body and the type of metrics that we get and that we approve and how that relationship works?
So we have a collaborative relationship in terms of our board is appointed by City Council. President Newbill is on our council. And so we have oversight by council through that measure. We also work closely with the city administration to provide information and be part of the health and the education and human services portfolio there as well.
Okay, thank you.
Thank you. We have no further questions.
Well, I would like to make a motion that we forward this back to General Counsel with the recommendation to approve.
Second.
The committee is voting on the motion to forward item 1. This is item 3, Resolution 2025-R038 to council with the recommendation to approve. Mr. Breton?
Aye.
Vice Chair Jones?
Aye.
The motion has been approved.
Thank you, Madam Clerk. We don't have any board vacancies. Approval of the minutes.
The minutes to be approved are for July 10th, 2025 for the Education and Human Services Standing Committee meeting held at 2 p.m. If there are no amendments or corrections, then the minutes will stand approved as presented. Those minutes have been approved. Thank you. Have been approved. Thanks.
Staff report.
Thank you, Madam Vice Chair. Will Perkins of the Office of Council Chief of Staff. Wanted to share Chair Lynch's thanks for everyone's support and time in attending the joint meeting last month with RPS and the mayor. We are helping to coordinate potential follow-up to that and want to, again, build on the collaboration and work we've done together across these bodies. So stay tuned there. Further, Ms. Lynch asked to share that she's currently revising the potential PowerPoint schedule for the remainder of this calendar year. We're in talks with DCAO Popovich's office on potential revisions to that schedule, which we'll share potentially as early as tomorrow for the October, November, and December meetings for this standing committee. And then last, I'll say, in terms of action items from today's meeting, Madam Vice Chair, I think I heard you ask for a visit to DSS, and I just wanted to clarify if that was to their new facility or to the south side.
The new one.
Okay, the new one.
Yeah.
Okay, thank you. So yes, so we can help coordinate that. So thank you. That's all.
Having no further business, this meeting is adjourned.